Well, the FDA advisory panel voted unanimously this week to update the next round of COVID boosters for the fall.
They would target the biggest strain of COVID that is currently going around. It's an Omicron subvariant called XBB.
The goal is the new vaccines that will give people longer protection from the virus. CW Health Chief Quality Officer Dr. Jeff Pothof is back with us.
Hi,
Good to see you again.
Pothof.
Hey,
We're
guys.
still talking about COVID.
Yeah, every once in a while it comes back
This
up.
is sort of like the flu shot. They're targeting a specific strain.
Yeah, I mean, this makes sense. This is where we want COVID to go, similar to the flu. We have an annual vaccine, say, and it's targeted at the specific strain that is most common in the United States right now, and that's what's happening here. XBB 1.5 specifically is the most common strain in the U.S. It's an Omicron subvariant, and to target that strain with a vaccine this fall makes good sense.
What else do we know about XBB1?
Yeah, I think, what we know about XBB 1.5 is that it's an Omicron variant, so really similar to the other Omicron strains we have. If we remember, the current booster has a little bit of the original strain in it, as well as BA 4 and 5, I believe it is, also Omicron subvariant. So thankfully, COVID-19, the variants haven't changed that much in the last several months, which means folks that, recently had COVID have some protection right now, but as we get closer to fall, that protection will wane. It'll be a good time to get a booster.
So I haven't gotten the latest booster. I just haven't had time. So should I just wait?
I think if it's June right now, maybe not a bad idea, especially if you're in that higher risk group, a little bit older, you have any comorbid conditions, to get that booster at this point. That doesn't mean that you'll be excluded from a booster in the fall, but what we don't want to see is people who wait too long, either between their last booster or their last infection. Their protection against severe disease starts to wane. They get COVID and then suddenly find themselves very sick, which is something that we haven't seen lots of recently.
Okay, this weekend I'll get it.
There you go.
Well, it's only June, but is this something they're doing as a precautionary measure, or do they need to give pharmaceutical companies a couple months heads up? I guess what I'm asking is, are we expecting another problem in the fall, or this is just getting ready?
I think it's a little bit of both. There's no way to know for sure if there'll be a problem in the fall, but with a lot of respiratory diseases, they do tend to have a seasonal pattern that gets worse fall to winter. Now, COVID's kind of broken that mold while we were in the pandemic. It kind of stayed present all year. But I think to your other point, the drug manufacturers, whether it be Moderna or Pfizer or some of these other makers, need to get guidance from the FDA on which strain they should be covering in their fall vaccine so that they can have it produced before we get to, say, September, October, and have it ready to go.
So maybe once a year, like a flu shot.
I mean, fingers crossed, but that would be all right. I'm okay with that.
Or both? Could they have a combined shot?
They could. They won't have that for this year, but right now it's going to be left arm, right arm. But someday it could just be pick one or the other.
Hope so.
You can dream.
You can dream.
Doctor, thanks for being
Thanks, Dr.
with us
Good to see
today.
you.